If you have knee arthritis, you might be thinking about having a steroid injection. In this video, we'll run through how these work, the typical duration that steroids last for, side effects, and other important things you need to know. As always, this video is for information purposes only, and you should speak to your doctor before making any decisions about your care. Steroid injections have been around for years and are really commonly used. They're often seen as the benchmark against which other injections are compared. There are different types of steroids, for example hydrocortisone, triamcinolone, depomedrone. They all act to reduce inflammation in the knee and dampen down the local immune response, which helps to reduce pain. Steroids are given as an injection into the knee, usually mixed with some local anesthetic, and as with all injections, this may either be using a landmark technique, where the surgeon will feel structures around the knee to know where to inject, or using ultrasound guidance, which is a more accurate way to know for sure that the injection is in the right place. So, how long do steroid injections work for? For most people with knee arthritis, they typically give pain relief for 2 or 3 months, but this is variable, and some people find they barely work at all, but others find it helps them for up to a year. Usually, the first injection is the most effective, and subsequent injections are less effective. Although they're only a temporary measure, they can be really helpful to give a window of time when the knee pain is better. This will allow you to really engage with physiotherapy and exercise to build up the muscle strength in your knee, which will in turn help alleviate the pain. Are there any risks of steroids? Well, with any injection, there is a small risk of infection, and as I explained in my other video, you should definitely not have a steroid injection within 3 to 6 months of knee replacement, as it significantly increases the risk of infection. There's also some evidence that steroids can cause accelerated damage to cartilage and the bony architecture around the knee. So although they give short-term pain relief, it may actually make the arthritis or loss of cartilage in the knee worse. In this randomized control trial published in the Journal of the American Medical Association, the authors looked at 140 people randomized to either steroid injections or saline over 2 years. They measured their cartilage thickness using MRI and pain scores. Surprisingly, there was no difference in pain scores at follow-up, but the cartilage thinned out faster in the steroid group. Now, for people with advanced arthritis using steroids as a last resort before knee replacement, this may be less important, as they've already lost most of their cartilage anyway, but it does make me anxious about giving steroids to those with early arthritis. Other risks of steroids include a temporary flare of symptoms for a few days and changes in the skin such as dimpling and the change in colour of the skin where it is injected. So, should you have a steroid injection? Well, they aren't without risks, but they're readily available, and in my experience, they do usually provide meaningful relief of symptoms. But if you're needing more than 3 injections, you need to have a serious chat with your doctor about whether other treatment options, including surgery, may be more appropriate. If you found that video helpful, please remember to like and hit subscribe for more videos coming up soon.